Yes, it's that time for us to talk about our health here on Smooth 98.1. My name is Joy Ureye, and on Smooth Health today, we'll be talking about your health. You know how it is you get to the hospital, right? And there are certain things, certain guidelines you are supposed to know, or certain documentations where your healthcare is concerned. Well, that is what we will be discussing today. Well, documentation is simply the written record of your health journey. Could be your symptoms, could be test results, medication, all that. That is the documentation. Certain people don't even know that those things matter to them, or they should have that handy, or at least it should be in their file. It's like a roadmap. When you're going on a journey, you need to know where you are. Even if you're in Lagos, you still need a map. If you don't pick, if you hey, have you ever tried to go to a certain place, you do not put check Google Map. It gets why. You can just be on your journey, and then it's interesting traffic. Let me put it that way. All because you didn't
Yeah.
way beforehand what that situation is going to look like. So it's also important. So your doctor, your physician who's checking you could also know what they need to know. And that is why it really matters. Today on Smooth Health, we'll be discussing that. And thankfully, I have with me Dr. Tobechi Ozuzu. He is the Quality and Compliance Manager at Reddington Multi-Specialist Hospital. Good evening.
Good evening. Hi, how are you? How have you been? It's been a while, as always.
Honestly, though, I'm good. I'm good. Glad to see you on the other side. Usually, one thing I know about Dr. Tobechi, he's always in the studio. But
Yes.
wherever you find him, where you know that is because it could not be helped. We, we understand. We understand. Even the doctors need their own, time to recoup on all the energies lost. So good to have you here. And
Thank you.
it's an important conversation. And this is as a from the quote unquote things that have happened in the most recent times. Hence why we're
Yeah.
having this conversation.
Yeah.
Um, because certain people don't, and I say this, certain people don't know what they are supposed to have handy. So once they go in, they just assume, hey, it's just a regular check now. What's the big deal there?
Okay.
Without that roadmap, even if a physician
Mm.
is treating you, they don't know what they're supposed to use, what is not acceptable for you, and all that. And hence why it's good to have Dr. Tobechi here with me to explain in the simplest of them.
Everything.
That's one of the things I like. He explains it, he breaks it down for you in the simplest of terms.
So that
What
everybody can understand.
honestly, there's no jargon. There's no grammar that is going to be putting, oh, those chicken scratch. Sorry, I didn't mean it like that. You know those chicken scratch that doctors will
No.
do.
And I promise you, don't worry. I'll break down the chicken scratch, okay?
So
Okay.
why really is it important to even write everything down during consultation? What does
Okay.
that
Okay, so let's talk about this. Not just about writing this down. It's important to have a process in which you're carrying out activities.
mm-hmm.
So each hospital, okay, no, let's say for example, your radio station. Because
Right.
I believe you frown against using of profanities, right?
Oh,
It's a
most
normal
definitely.
thing.
No,
Yes, and then
absolutely
you also
not.
frown against it's against the protocol that kids of probably below 18 call in without permission. Those are your
Most
guidelines. Those are
definitely.
things that
Right.
you abide to. Now, hospitals should have such processes. Now, let me give an example. Based on the last issue that happened, I think with Chimamanda and all, like I said, we have to be very careful using allegedly because we don't really know what is going on.
True.
Every hospital should have a process. So the
Mm.
first question is, did the hospital have a process with regards to the administration of the anesthetic? Did the hospital have a process to monitor an anesthetic that was administered? Did the hospital have a process to monitor the child? So every hospital has what you call processes and guidelines that doctors adhere to and ensure that they document strictly. So everything that happens. So in as much as the case with Chimamanda, yes, has come out to the public and all, whoever is going to investigate the case is going to look at what are those processes? Are they in line with best practice? Did the doctor document? Did the doctor say this is what it is? Was this followed through? Was this process done step by step by step? Now, if those steps were not taken, one chance will enter. So that's why it's advisable that all physicians, all healthcare workers know what the process is. Not only do you know what that process is, you also document. Because at the end of the day, the truth of the matter is this: you'll be judged based on what you
Based on
document.
that.
In fact, the mantra is if it's not written down, it's not done. So you can
Oh,
yes, you can afford to speak all the English. Anybody will ask you is where did you write it down? Who saw you when you wrote it down? Where was it
okay.
documented? So as patients, we should understand the importance of documentation. Because at the end of it, let's say, for example, you want to you want to travel abroad or you want to go to another hospital and you demand for your documentation, your files.
Right, right,
It should have a summary of everything you've treated, all the medications you've taken, all the tests you've taken, everything, it should be there. All right? Everything that has
right.
been done for you should be documented. Whether you give consent, whether you did
Oh
not give
no.
consent, the ones that you were okay with, even the fact that you said, oh, doctor, I don't want you to treat me. It all has to
It
be
will be
written down.
documented.
Yes, it's important. So
Right.
most hospitals fall short of that, where you see poor documentation.
Mm. Now that can actually be very scary when
Very.
especially when life and death is concerned, those things are important. It helps you figure out, okay, these are the guidelines. And it also brings to the fore. I spoke about something along these lines, standards and operations and the likes. And a caller had spoken about how he was working in the medical industry at a
Okay.
time. And he said that there was a certain situation he had been in. He was the
Yeah.
administrator,
Okay.
but because there were procedures that were supposed to follow through, unfortunately, a woman, a patient had been brought in. She gave birth, but the doctors who were attending to her, quote unquote, new doctors,
Yeah.
didn't do the needful and left
Okay.
the child there and went and declared to the parents that the child was dead. And yes, he then, as the administrator who was supposed to follow through, because, like he said, there are guidelines and procedures to actually ascertain that that child was dead, went in so that they hadn't done the things that they were, the procedures that they were supposed to follow through, did what they were supposed to do to the best of his ability. Guess what? That baby came to life. He now had to rush back down, call their
Wow.
attention, let them know that that information they were giving was not right. But because there were procedures in place and he was following through, so at that time, those ones were culpable. Did you follow due process before declaring this? You just wanted to do your bit and be out of there. He said at that point in time, he knew that these ones weren't staying. He wrote his report, and those were chalked out. Lagos, this is why we're talking about documentation guidelines and why it actually matters in healthcare. We'll take a quick breather. We'll get back in and we'll continue. I have with me Dr. Tobechi Ozuzu. He's going to explain why these are necessary. We're not making excuses for anyone, but we're saying that do you even as a patient know what you're
Wow.
expected to know and how you're supposed to follow through, questions you're supposed to ask? You in administration, do you even know what you're supposed to do? That and more we'll be discussing on the other side. Don't move from our soul.
Wow.
I
Wow.
was I was equally stunned when he shared
Wow.
that.
Wow. Do you so now in that scenario, you have two people to blame, two groups. That means the hospital on its own did not give a proper orientation to the staff. One, two, the staff themselves. So the question is, so see this thing I discussed with you now. Because the hospital has a system, you have to think, one, did the hospital train their staff? Two, did the staff acknowledge that they've been trained and then do this out of incompetence? So because this so because this guy knows the process, that means the hospital have been training people. For him to be in the system and know, it may not be the hospital's fault. All they need to do is
Right.
to show evidence that they've trained. But then man, what kind of practitioners are they? Oh God of mercy. Oh,
Calm down, breathe, breathe, breathe.
oh, this is why they take the licenses.
This is
Are
why
you
they take
kidding me?
license. So
Yes. Because it's inexcusable. Ah, wow. Wow.
okay.
Wow.
Let's get back in. Yes, this is Smooth Health here on Smooth 98.1, 33 minutes done plus 5. And today on Smooth Health, we are talking about documentation and guidelines where healthcare is concerned. You want to share your thoughts? You will have questions? Well, I have with me Dr. Tobechi Ozuzu. He is, uh, let me make it understandable for you. He's the quality and compliance manager at Reddington Multi-Specialist Hospital. And you have questions, please, by all means, ask. You're confused about certain things, ask those questions. I have him with me, and he is breaking them down. The things you need to note, how things need to follow through, and all that. But here's a question. And I know you're still reeling from what I shared with you before we went on that quick breather, but here's something I want to know. What can
Yeah.
actually go wrong if a patient's records are not properly kept? Because certain hospitals still have the manual process. So files can go missing.
In fact, if there's the highest level of negligence in the
Mm,
world is lack of documentation or missing documentation, do you know what it means for you to react to a medication and then because we don't have the documentation, because we misplaced the documentation, you
right.
come into the hospital and a new doctor who was brought into the system, who checked and did not see your records,
Mhm.
gives you that medication. What do you think will happen?
Yeah.
A
You
patient will end up dying.
plenty
It is,
things.
it is completely unheard of. In fact, I think the data protection states that you should have the patient's documentation for up to either 5 to 10 years or so. I'm not so sure. I'll probably get the exact figures, but you should have the
Okay.
records kept for up to 5 to 10 years. That should tell you how important documentation is.
Mm,
It's not something, in fact, it is the reason why it is because of how important documentation is. That is why hospitals have tried to move from the folder thingy to the EMR.
okay.
It is what motivated that movement because it makes it easily accessible for someone to have seen you 2 years ago. And
Mm,
because the truth of the matter is this in medicine, whatever may have happened 2 years ago may have had a reflection on what your current condition is. So for the
right.
doctor or whoever to have a holistic opinion, he will have to go through everything to
Mm,
give you the appropriate care. So imagine if I don't have the documentation as I last year, and then I'm starting all over again. I started blind based on the little
huh.
symptoms I've seen. Do you get where I'm? Do you know why? So it has
That's a lot.
far-reaching effects. Or maybe for example, you were brought into the ER last year with a blood pressure of something very high, and then I never knew you had such a blood pressure. I never knew you had hypertensive urgency, and then you walk in and I'm treating you like a no. Nah. So documentation is as I see, one of the best things a doctor can do is to so one of the people I love with regards to their documentation are the nurses. The nurses write everything. They write everything. These are the ones
As
that
they
want
say,
to
it
know.
gets why.
They write they write everything, and it's good because at the end of the day, when you have litigation, when you have issues, what saves you is what you write. So let me give you an example. It was a case that happened. It was all over social media last 2, 3, 4 months. A man allegedly said he went to the hospital. His wife came to give birth. His wife walked in pregnant, and the wife and the child came out as corpses and they died. And the hospital was negligent. Said all sorts of things. Everybody then condemned the hospital, said a lot of things. Also, social media, people tend to pronounce you guilty before you're guilty. Lo and behold, when the matter went to court, apparently, while the woman was pregnant, the hospital said, "Oh, sir, your wife has what you call CPD, like she couldn't give birth. The labor was being prolonged. Let's do a cesarean section to save baby and mommy." The man said no. The doctor documented it. Time, he said no. The nurse documented. 10 minutes later, "Sir, please, this is progressive. Can we go ahead?" He said no. They documented it. "Sir, do you understand the risk you're putting?" Yes, they documented it. They called the next of kin. In fact, they used the woman's folder to call the mother to tell her. They went the extra mile to
explain
what we are facing. He has said no. Please prevail on him. Nothing. Lo and behold, this woman labored. The child became distressed and died. And before you know it, the woman had postpartum and she passed on. So when this was taken to the MD, when the law court, they said the hospital followed their process. They even did more. They showed the documentation. They showed the time. They even documented the man's response. I think he wanted to consult his spouse. I don't know, whatever it was. Step by step by step by step. You see how documentation has saved them. Nobody had anything about that case anymore. Nothing was done because they did everything they offered. It wasn't even a question of the money for the cesarean section. They just wanted to save the woman and the child.
And the baby.
Yes. There was no documentation about
then
money.
After that, we can now discuss whether the money is there or not.
So imagine if they had not documented, and the man says, "You people said this." The time frame was there, the conversation were there, people that were involved signed signatures, the witnesses were there. The second time they spoke to him, the third time they spoke to him, the call log when they called the mother-in-law. I said they evidence full. So documentation cannot be overemphasized. It's the bane of medicine right now. The bane of medicine.
Oh, okay. Now, as patients, because now we've spoken at least from the angle of the hospital. As patients, how much responsibility do I have when it comes to my own medical records?
Okay, so it is. So one of the things, remember the last time we spoke, I spoke to you about what you call patient rights. Patient rights are those set of rights you have with regards to the level of care you receive in the hospital. One, you have the right to access to your documentation. It is the number one right you have. From the moment you step into the hospital.
Let me just let you know that usually is very difficult. You get to some hospitals and then they tell you, "Sorry, we cannot divulge this unless the physician says we can give you."
Nope. It is your documentation. See, if you take the hospital to court, right? Let me give you this instance. let's say, for example, there's a medical case. The
Okay.
only thing they can judge with the medical case is the documentation. So you have access to it. It's not for any hospital that says they can't give you your documentation. It's a laughable thing because it is your document, it is your case, it's your body. It's not next of kin. So I'm not talking about. It's one thing to say, okay, oh, I want my mom's documentation, and maybe I'm not the next of kin
Okay.
on the
All right.
folder. That's a different thing. But this is
Okay.
your. This is you went to the hospital 3 times. You saw the doctor. He wrote, and it's your right to pack everything and go because it's your right to seek second opinion. And whoever you're going for second opinion will say, "What have you done? Let me see the things you've done."
Mm.
Do you understand why because anybody will ask you, okay, how long have you been having this illness? You said for 4 years. What have been the things you've done? You now pack all those documents, all those
And
files, all those records, all those investigations, and give them. They will now say, okay, oh, this was done well, this was not done, whatever the case may be. But that gives them an idea. They're not going in blind. They are going in based on the fact that if someone has seen you and this is a progress level, whether the person did well or not, that's a matter of another opinion. But the question now is, what is it going forward? You understand? So documents you have, it is your right. It is your. So when I hear that you don't have the right to your investigation, to your documentation, I laugh because no cost of it's enshrined in it is your absolute right to the access to the documentation. It's your case. It's one thing to say maybe you're next of kin, maybe you were not the one on the next of kin. But if it's you, they'll give it to you anywhere, anytime.
okay. And in the instance where, say, for instance, you've been treated and then you ask for your documentation because you are transferring to somewhere else, even if it's within that same Lagos, maybe, for instance, I used to live on the island and then I'm
Yeah.
moving to the mainland. And I know that access through and fro might be deterrent and I need regular checks. And
Yeah.
possibly within my records, I notice that something is missing or incorrect. What then do I do?
So
Do
you have a
I,
right.
okay.
Yeah, go ahead.
I
Go
was going
ahead.
to ask, am I supposed to go back to the former hospital or am I supposed to lay bare at the new hospital that I registered?
So there are 2 things you can do. Let's say, for example, so it depends on, is it that the results were incorrect based on what they did, or there are things that were missing?
It could
Which
be
of
both.
them?
It could be
Okay,
both. I'm just giving that instance, yeah.
okay. So like I said, there are 2 responses to that. So let's say, for example, you had some missing investigations, and these were
Okay.
investigations you felt you did. You could go back to the facility if you remember the day. So that's why you, on your own part, too, should also remember
Okay.
the
Document
days of your
thing.
interaction with the facilities. All right.
Right.
That's why when you go in, when you go to see a doctor, most of the, especially most of the private hospitals will tell you, okay, this is what we've seen. These are the investigations we want you to do. So and
Mm-hmm.
so, and after that, they'll give you a copy of your investigation results. You understand? Now, if you went, if they gave you all your documents and those ones were missing, you can afford to say, okay, so and so I came to your facility, I
Mm-hmm.
did this. Unfortunately, the results are not there. Kindly send them to my physician, or kindly send them to me. They'll send them to you. Now, if there's an error in the results, and you have a copy, so you see why it's important for you to have access to your results, because you could have a situation where someone could say, "Oh, we checked you for." Let me use the typical one that happens. We checked you for a breast CA. They did a what do you call it now? An
Mammogram.
incision biopsy,
Okay.
a biopsy,
Oh, okay.
and they said, "Oh, we checked and we didn't see a CA." All right. You now go somewhere else and they check and they say, "Yes, there's a CA, there's a cancer there." The question will now be, can now comfortably say, "Where is the sample you took? Which hospital, which lab did you take it to? Give us a rundown of the process." And they have a right to respond to you. There have been litigations that have been won whereby people were diagnosed late of CA simply because facilities, labs, or whatever had errors in those things, and they had to pay the price. See, documentation is not. See, the world has gone
Beyond just
so yes beyond the bamboozling stage where someone tells you no, you don't have. You have access to everything, every single thing. In fact, it starts from your if they are compiling if they want to go for a legal issue, it starts from your admission letter. Your that when you go into a hospital, that thing where you sign, it starts from there. They want to know the day you came, the first day you came. That's how important documentation is.
mm. So in the instance where things don't turn out the way it's appears, what should one do?
Okay, so you have agencies that handle um, issues like this, like the same agency that um, Chimamanda has resorted to. FMI is there, MDCN is there. They are willing and able to investigate. And one of the things I've known is that by the time you give them the evidence, they go in and do the job. They are one thing I know is that medical negligence is not something people joke with anymore. It's something that, how will I put it now, that people are very, very scared of. Most hospitals, most facilities do not joke with it anymore. All right. They try as much as possible to adhere to it because they know that people will clamp down on them. They are so both lawyers, you have lawyers that are specialized in medical issues, you have the FEMA people that will come in and close the hospital, you have the MDCN that will come in and look at the licenses, you have the board for the nurses too that will come. So everybody checks all these things. All the checks and balances are there. So right now, people speak, they'll tell you once you have a case, once you feel there's something wrong, you
Right.
escalate to them and they will handle it.
Okay. As much as I'd like to keep you and keep the conversation going, time never is our friend when we're talking about setting matters like this. But for anyone who's listening and would like to ask further questions, get further insights, how can they reach out to you on your social media handle?
Okay, so they can reach out to me via my Instagram. It's Toby Ozuzu. So TOBYOZUZU. Any questions you have about negligence or any issues whatsoever, feel free to bring it to me and then I would definitely help you. Then I'm also on LinkedIn too. It's just Tobechi Ozuzu on LinkedIn. I write, I give out ideas, I share tips and all on patient safety and all. So reach out to me on Instagram, Toby Ozuzu, TOBYOZUZU, or on LinkedIn, Tobechi Ozuzu, TOBECHIOZUZU, and I'll be there to help.
All righty. Thank you so much for that insight. And
Thank
Lagos,
you.
I'm sure that you've taking all that in. So at the end of the day, documentation and guidelines are
Are
they're all
key.
about
They're
safety.
important.
They're all about
True.
your safety. So please be careful, be thoughtful, ask questions because when your health is involved, and I mean every detail matters.
It's important. Yes. So every single detail is important.
And make sure that everything is properly documented for your good. Well, that's the
That's
much
true.
you can take. Thank you. That's so much you can take this evening on Smooth Health. It comes your way every Thursday at 5:15. So till next week, Thursday, I'm sure we'll be having another conversation, this time very introspective one. And this one you would not want to miss as well. On the other side, there's still much more lined up for you. Plenty, plenty music as well as conversation. So don't move a muscle. Stay glued to your radio. Smooth 98.1.